I want to wish everybody a good afternoon. I apologize for leading to my presentation last, but because of California time, that was the only period possible. It's a pleasure to talk about animal and in One Health field, and I just want to refresh you, and I'm sorry I was not able to watch yesterday's presentation on Bartonella because of time difference. But basically, I want to emphasize that Bartonella are alpha proteobacteria which are much closer to Brucella than they are from Rickettsia or even A.F.I.P, which is not at all agent of cat scratch disease anymore. So this slide is very busy, and it's just to tell you that within the 25 to 30 last years, the number of Bartonella species has been increasing considerably. And basically, I will quickly summarize: any mammalian species you are looking at, you are more likely to find a Bartonella species, with some species that are highly adapted to one specific host, and then some of them can be more polyvalent. So here I try to summarize the condition caused by Bartonella species in humans. And as you can see, we have a very long list that is increasing on a regular basis to show that many of the Bartonella species are zoonotic. But the one that we are not directly concerned as a zoonosis is Bartonella bacilliformis, which is the agent of carrion disease. But all the other one, as you can see, I put in blue a little z, which means zoonosis. And I also try to quantify the number of human cases that are occurring on a yearly basis or that have been ever reported in the literature. And you can see that beside Bartonella quintana and Bartonella henselae, all the other Bartonella species that have been reported as zoonotic are leading to less than 10 to 5 human cases reported in the literature. But what you will see also in this table is that quite a few of these non-dominant Bartonella species are also agent of endocarditis in humans. So just to review the problem of endocarditis, and that's a lot of work has been done in France by the team of Professor Didier Raoult and people from his lab. And as you can see, one of the big issues is that for a very long time, many cases of endocarditis were blood culture negative. And as present time, it's about 20 to 30% of all documented cases of B, C, and E, which are caused by Bartonella, basically being next to Coxiella burnetii. Here's an example of a human case of endocarditis caused by Bartonella henselae. So the number of reported cases of Bartonella endocarditis have increased between 2005 and 2013. And as you can see in the study that was published by the group in Marseille, there was 59 cases added to already almost 200 previous cases, which lead to at least more than 250 cases reported in different centers. So this publication is reviewing a little more than 100 cases. And as you can see on this slide, mainly we have one characteristic of Bartonella endocarditis is that usually it's most frequently associated with high antibody titers in humans. And we'll talk also about animals, and we'll see that there is some commonalities. Also in terms of frequency, you can see that most of the cases of Bartonella quintana that were reported in that study were caused by Bartonella quintana, more likely in homeless people, followed by Bartonella encellae, and much less cases caused by Bartonella alzatica and Bartonella winsoni, but here they should have specified the subspecies because we have 3 subspecies, Winsoni beckoffii, Winsoni winsoni, and Winsoni arupensis. There is also a gradient that has been clearly shown by the group in Marseille that goes from very low prevalence of, very low prevalence of endocarditis caused by Bartonella in northern latitude. So you can see that in Sweden, the prevalence is less than 1%. It's around 1 to 3% in Western Europe. And when we move to North Africa, the prevalence is much higher, close to 10%. And the example is for Tunisia, but similar situations have been reported for Algeria and Morocco. What we need to emphasize is that there is a difference. In Tunisia, it's more likely to be Bartonella quintana. In Northern Europe and Central and Western Europe, it's more likely to be Bartonella, encellae, and quintana. Of course, Bartonella is observed in people who have maybe immigrated in countries. And so that study is quite interesting in Great Britain that shows that a lot of cases are caused by Bartonella quintana and are more likely to be in people who have been immigrating from countries where the infection is quite common. As you can see on this slide, the word aortic valve is the one that you see the most, and that's a characteristic feature of Bartonella infection in humans is characterized by a tropism more likely to occur on the aortic valve. So let's talk about cat scratch disease, because cat scratch disease is a very common disease in young humans, teenagers, young adults. And now we know much more about this disease. We know that in the non-immunocompromised person, it will cause the characteristic cat scratch disease with the enlarged lymph node, where in the immunocompromised person, it's more likely to cause bacillary angiomatosis, caused both by Bartonella quintana or Bartonella encellae. If we have a Bartonella quintana case of bacillary angiomatosis, it's usually in a homeless person who has been exposed to lice. If we have a case of Bartonella encellae, it's more likely to be a person who has been exposed to a cat and likely been scratched by a cat. The cat is the reservoir of Bartonella encellae. It's present in its red blood cells and in its endothelial cell. And we were able to demonstrate that without fleas, no transmission occurs from cat to cat. You need to have the fleas present for the transmission from cat to cat, and it's more likely the flea feces that are the source of human infection and infection. So here is some pictures, a nice picture of Bartonella encellae hiding in the red blood cells. And now let's move to the animal that also fits well this story of endocarditis associated with Bartonella infection. Here are all the Bartonella species that so far have been reported, identified in canids. And you can see that the most common one are Bartonella winsoni beckoffii, Bartonella encellae, followed by Bartonella rochalimae, and then we have a whole list of other Bartonella species that are more or less commonly identified, but that have been identified in dogs. So in dogs, what are the clinical features? You can see that most of those Bartonella species are associated with various clinical manifestations. It has been associated with a very diverse field of infection for beckoffii, for encellae, much less for other species where the cases are much less also. But you can see that the common denominator here is most of them are associated with identification of cases of endocarditis in the dogs. Here's an example of a dog a case of a dog we took care of in Davis, and unfortunately that dog died. You will see that the case of endocarditis in dogs are very, very severe, and the prognostic is usually very sad, and very often it ends by euthanasia or death of the dog. But some dog can be treated, and we'll talk a little bit about that. So it's the first case ever reported of Bartonella clarigiae detected in a dog at UC Davis. So we did also a survey of dogs at the veterinary teaching hospital for the period 1999-2001. And you can see that in the study of a little less than 18 dogs, the cause of complaint were lameness, lethargy, anorexia, respiratory problem, weakness. Most of the cases, the involvement was the aortic valve and or the mitral valve. And in terms of the etiology, we, for this specific study, we found that Bartonella was the dominant cause of these cases of endocarditis. So that's the specific study. And here I just want to emphasize a few things. First, in terms of the breed, it's usually middle-sized or large-sized dog. We rarely see endocarditis in what we call the pocket dog, the tiny dogs. And also, as you can see in terms of age, it's usually middle-aged dogs. You can also see that the valve that is infected, and all the cases that are positive for Bartonella are in yellow. You can see that we all have them with aortic valve infected. And we have high antibody titer, very similar to what we see also in humans. In terms of blood culture, it is very difficult to isolate Bartonella from culture, just like for humans, and particularly in cases of endocarditis. And I will emphasize that it's the reason more likely we think that the endocarditis is a chronic result of the Bartonella infection, both in humans and in dogs and other species. And as you can see, by PCR, we have different Bartonella species involved: Bartonella clarigiae, Bartonella vinsoni, Berkhoffii, and the BC-like is in fact Bartonella rochalimae. Another interesting point that was emphasized by work from Ed Breitschwert's group showed that a lot of those dogs are also seropositive for tick-borne pathogen. That led us to think that possibly tick could be involved in the transmission of Bartonella infection. However, recent knowledge clearly indicates that the main vector of Bartonella infection, except for Bartonella bacilliformis, and Bartonella quintana, is usually the fleas. So here is another study that we did and we published recently, where we did a case control study where we went to the archive of the US Army to look at dogs that had been diagnosed with endocarditis. And as control, we selected dogs that had hip dysplasia, which is unfortunately a common cause in German Shepherd and a cause of dismissing the dogs. And we wanted to be sure that those cases were free of cardiac lesion. In terms of the diagnosis, we used staining of the valve. We did DNA extraction, and we used the sequencing, the PCR of the citrus centers gene, which is a gene that's pretty good for differentiating the different Bartonella species. And as you can see on those results, we were really surprised to identify almost 75% of our dogs were PCR positive for Bartonella, whereas for our control group, we had only one dog that was weak positive. As you can see also, we had 20% of those cases that were positive on Wharton staining, and clearly showing the location of this Bartonella in the cardiac valve. And in terms of Bartonella species, we had quite a wide range of Bartonella species, mainly Bartonella henselae, followed by Bartonella vinsoni subspecies Berkhoffii, but also other Bartonella species such as Elizabethae, the natural reservoir rodent, Washensis, natural reservoir ground squirrel, and then we had some mixed infection for which we're not able to differentiate. Similarly, we looked at another study where we looked at dogs that had endocarditis and that were necropsied at the teaching hospital, at the School of Veterinary Medicine in Davis. And what we found here is that we had about almost 40% of the dog were PCR positive for Bartonella. And again, you can see that the age was, the mean age was 9 years, and many dogs had a history of polyarthritis and swollen joint. So to summarize a little bit the data and comparing human and dogs, in France, you can see that about 3 to 4.5% of the human tested for endocarditis, and particularly non-culturable endocarditis, the percentage was 3%, similarly in Germany, less in the UK, Sweden. As I mentioned earlier, Tunisia, almost 10%. But look at the dogs. In dogs, for 2 different studies, so you can see 3 studies that we did at UC Davis, and we are between 20 and 30% of the dog with endocarditis infected with Bartonella. And here a study in Colorado where they were at almost 8%. I tried to do a summary of all the published cases of endocarditis in dogs around the world. And as you can see here, it exists almost everywhere around the world. Of course, most of the research has been done in the United States. So you can see that we have a predominant location in the United States, but you can see that it's been found in Spain, in Israel, in New Zealand, in Brazil. And here are the different species involved. You can see that Bartonella vinsoni, Berkhoffii, and we have different subtype here, types, sorry, in the subspecies. And clearly we have a dominant aspect with Bartonella vinsoni, Berkhoffii. We have also a dominant phenomenon with Bartonella henselae, very few cases of Bartonella quintana, a lot of cases of Bartonella rochalimae. We have to be aware that Bartonella rochalimae, the main reservoir so far is likely to be canids. So Bartonella species associated with endocarditis in humans and in dogs. You can see the comparison. Quintana is dominant in humans, very few in dogs. Henselae, it's about the same in dog and humans. And then we have the other species which are more likely to be found in dogs, and particularly for vinsoni, Berkhoffii. We have a few cases both in dogs and in humans for the other type of Bartonella species. So we also wanted to know what's going on. So for Bartonella, we have demonstrated that coyotes are important reservoir of Bartonella vinsoni, Berkhoffii in California. So we wanted to know how common is the presence of Bartonella in cardiac valve of coyotes. Unfortunately, our study was limited by the resources, and most of the coyotes we had that were killed because of depredation were young coyotes. So we didn't add adult coyotes. Most of them were 1 year or younger or less than 2 years old. However, we were able to amplify Bartonella vinsoni, Berkhoffii from a large number, almost 20% of these coyotes. We look both at the cardiac valve and at the spleen. The idea of looking at the spleen was to let us to know if the animal were bacteremic at the time of testing versus the cardiac valve. As I mentioned to you, usually it's more likely to be culture negative and PCR positive on the cardiac valve. So in terms of endocarditis in humans and in dogs, as you can see, in humans, it's estimated that 14% of the case of endocarditis are culture negative endocarditis, whereas in dogs, it's about almost 30%. You can see that in terms of the classical endocarditis cases in dog, we are more likely 2/3 for 1/3 having mitral valve versus aortic valve. But when we look at Bartonella positive endocarditis cases, the percentage are quite different and very, very similar in dogs and humans, where you can see that more than 70% of the cases of Bartonella endocarditis, either in dogs or in humans, are on the aortic valve. So I want to mention also some studies that have been done by the group of Ed Brightworth, where they looked at Bartonella in dogs. They use a specific technique where they enrich, they try to do blood culture in an enriched culture medium that lead them to better detect infection of dogs, for which, as I mentioned to you, it's quite difficult to isolate Bartonella from directly from blood culture. And you can see that that specific medium was required for PCR detection in almost half of the cases. So here is some results of the blood culture and serology. And one thing I want to emphasize from this table is that, and it's been similar in the lab of Ed Brightworth and in my lab, we have many cases where we have PCR positive animals that are seronegative. So basically relying only on serology is not always the best technique to diagnose Bartonella infection. So let's summarize for the dog and indicate that the dog is really a perfect model to see of what can occur in humans. The dog have a similar clinical spectrum of infection than humans, and particularly when we are looking at endocarditis, the dog are excellent sentinel of what we could expect to diagnose in humans living in the same geographical environment. However, there is some limitation. We have to emphasize that pet dogs that are well taken care of are very unlikely to be infected with Bartonella. The different studies that have been done either at UC Davis on more than 3,000 dogs or at Ed in North Carolina, Ed Lab, shows that in pet dogs, the prevalence, the seroprevalence is less than 3% or around 3%. As soon as you are starting to deal with free roaming dogs, with dogs that are pet dogs, but that can roam, then the infection rate is much, much higher. We did some study on Indian reservation in Northern California where we found up to 20% of the dog infected with Bartonella. So as you can see here, we have Bartonella species identified in dogs, but also identified in cats, identified in cows. So we'll talk a little more about those species. Finally, for the dogs, I want to mention that treatment is possible. And there is a recent paper that was published a few weeks ago by the group of Ed Brightworth, where it's reporting 7 cases of Bartonella rochalimae infection in dogs, of which 5 had endocarditis. And some of the dogs survived and were treated with 2 antibiotics. So basically, an example here, one of the dogs received doxycycline 6.6 milligram in the morning, 3.3 in the evening. for several weeks. And another dog got a similar treatment with the same antibiotic, but with only with 5.3 milligram twice a day, plus addition of enrofloxacin antibiotics. So usually treatment of dogs, and that's largely based on all the work done by Ed, was the association of two antibiotics, doxycycline and enrofloxacin. Other treatments that have been reported are using azithromycin plus doxycycline with long-term treatment. The first dog that received 6.6 milligram per kilo was treated for at least 21 months. Now let's move to cats. The first report of endocarditis in cats was a publication from Australia, where we had a few cases, and again, we had aortic and mitral valve that were involved, and we also reported the diagnosis of Bartonella ensele type 1 infection in the domestic cat in California. We did also experimental infection of dogs with different species, and particularly we inoculated dog with a coyote strain. And as you can see in dogs, you are going to have a high bacteremia about 7 days after inoculation. And within 40 to 50 days post-inoculation, you are going to have a decline of the level of bacteremia, but you could have persistent and chronic infection in those animals. So this slide is to try to summarize here what are the conditions in humans, in cats, and in dogs associated with Bartonella, either Bartonella ensele or Bartonella winsoni berkoffi. So chronic bacteremia is the most common thing seen in cat, much less in human and dogs. We have in all species lymphadenitis, granulomatous rhinitis, and other type of infection. Bacillary angiomatosis has never been reported in cats so far, whereas it's been largely reported in humans, and a few cases have been reported in dogs. One point I want to emphasize here, the reason why we don't see bacillary angiomatosis in cats is very likely because cat infected, so in humans, it's associated with people who are in advanced stage of HIV infection. Cat have a similar virus, the A.F.I.P, and the big difference between cat and humans is that usually cat don't crash down, human have a long-term infection, whereas in cat, you don't have clinical sign, and then they crash down very, very fast. So you don't have a situation where you have low CD4 cells in cats, whereas in humans, bacillary angiomatosis is more likely to be seen in people who have low CD4 cases. So endocarditis, myocarditis have been reported. There is even worse symptoms that have been reported with neurological symptoms, uveitis and ocular lesion on all species, renal lesion have been reported. And the previous presentation talked about the risk of transmission of Borrelia in pregnant women. Here, reproductive disorder have been reported largely in one study by Ed Breitschwerdt in humans, yes. In cats, we have shown that and another group has shown that we have reproductive disorder, but in cat, the placentation is different. So usually there is no transplacental transfusion. So it's more aborted pregnancy that occur in cat. And so far in dog, we have not been able to document that. So briefly now, endocarditis in some other species. It's a work that I did in collaboration with Professor Henri-Jean Boulouis from Maison Alfort, and where we looked at the risk of endocarditis in cattle, and we were able to identify cases in rather elderly cattle in southern France, and where we detected Bartonella bovis. As you may know, cows are the main reservoir of Bartonella bovis. They are also the main reservoir of Bartonella chomeli, but so far no pathology has been associated in cattle with Bartonella chomeli. Here is another report from a cow in the United States. Again, a 7-year-old pregnant Angus cow found dead, endocarditis, and you can see those typical vegetative lesion on the valve, aortic valve. And again, the animal was positive for Bartonella bovis by PCR. So one thing I want to summarize here is that, as I mentioned at the beginning of my presentation, Bartonella is close to Brucella. And you know that Brucella can cause endocarditis in humans, and also a few cases have been reported in animals. But here this slide is mainly focusing on humans. You can see that the frequency of Bartonella endocarditis is 3 to 4%. For Coxiella, it's 3 to 5%. In Europe, most of the cases are associated with Bartonella quintana and Bartonella ensele. Localization of the valve, it's aortic mitral valve in humans. And most of those infections are, for Bartonella and Coxiella, the results of a chronic infection, whereas for Brucella, it can be either acute or chronic. The sex, human male are more likely to have endocarditis than female. And in most of the cases, you are going to have a high to very high antibody titer. And for Brucella, you could have, usually you have a culture positive when it's an acute form of endocarditis. And as you can see, the letality rate is quite high, ranging around 20% for Bartonella, a little less than 30% for Coxiella, up to 80% for Brucella. And to conclude, endocarditis can also be present in wildlife. And we did a study of sea otter from California and Alaska. We had a die-off outbreak in the sea otter from southern Canada, southern Alaska, and clearly Streptococcus infection was the main cause of death of those endocarditis, but we wanted to know if Bartonella could be involved, and we clearly identified Bartonella. And as you can see, we identified mainly Bartonella washensis, Bartonella hensele, and a Bartonella that's been called Bartonella volans in those sea otters that were dying of endocarditis. However, we were not able statistically to show an association between the death by endocarditis and infection by Bartonella. However, we think that the Bartonella infection in the cardiac valve of the sea otters were favoring the superinfection by Streptococcus species. So that's all I wanted to mention with likely a chronic infection in animals and humans, and I'm open for any question.